It's widely known that in dogs older than 2 years, a condition called intervertebral disc herniation is the most frequent culprit behind myelopathy. However, the landscape of spinal problems might look quite different in younger pups, those 18 months old or less. This crucial area hasn't been thoroughly investigated until now. This research, conducted across 4 referral veterinary institutions, aimed to fill this knowledge gap by describing the common causes, how these conditions typically present, and what might be behind them in this younger age group. The researchers also sought to understand if specific clinical signs were linked to the most frequently identified causes of myelopathy. Their primary belief, or hypothesis, was that intervertebral disc extrusion would not be the most common cause of myelopathy in these juvenile patients. The study population comprised a diverse group of young dogs, with a median age of 8 months at the time of presentation. Many different breeds were represented, but some stood out as being more frequently affected. Notably, French bulldogs were the most common breed, making up nearly 23% of the cases. Pugs also featured prominently, accounting for 8% of the dogs, followed by crossbreeds and English bulldogs. Interestingly, when the researchers looked at breeds known for having a screw tail, or pugs together, this group made up over a third of all the dogs in the study. After careful review of all the cases, the researchers identified a total of 31 different underlying causes of myelopathy in these young dogs. The top 5 most frequent diagnoses were vertebral malformation, which was the most common, affecting almost 19% of the dogs. This category included various abnormalities in the shape or structure of the vertebrae. Following vertebral malformation, the next most common were spinal arachnoid diverticulum, traumatic fracture of the vertebral column, atlantoaxial instability, and osseous-associated cervical spondylomyelopathy. Intervertebral disc extrusion, the condition so common in older dogs, accounted for only 4.5% of the cases in this young population.